Hey guys, Assalamu alaikum. This is Omar Abdul Malik, physician assistant and health educator. So it has been about, what is this, 6 days since my first Moderna injection. Um, so I'm due for my next one February 8th. So I feel pretty good. I had some soreness in the arm, so one of the trolls in the comments section was like, "You better not hide any of the negative side effects like they're doing." I don't know who they are. So it's been really interesting. Uh, it's interesting to me because I people are really um, against the vaccine. Not everybody, but quite a number of people, and they go on this attack against those of us who are getting it, who are actually healthcare providers. I mean, I've had COVID patients, and I've seen what COVID-19 can do to people. Now, I can't confirm or deny that it was man-made and with alien DNA from harvested from the alien cadavers in Area 51. And, you know, placed with nanites and luciferase enzymes to make us glow in the dark so they could track us. You know, I've heard some of the most interesting conspiracies in the comment section since I posted my video about getting the vaccine. Um, One guy said that I was a member of a satanic cult because I happened to be wearing the color orange, and that was a sign that I was with the satanic cult who made the vaccine and the virus. And somebody else said that I had been injected with synthetic particles, and somebody else said that the COVID vaccine contains HIV, which I had not heard before, and adenovirus is from chimpanzees, which may explain my sudden urge to go eat apes together strong. you know, but I've never heard some of these conspiracies before, but I think I'll do a video just on where conspiracy theories come from. I say this is an African American or Black American. We go back generations. My grandfather's from Richmond, Virginia. His dad was from Richmond, Virginia. And we were slaves before that. So we've been here for a while. My peoples have been in this country for a while. So we have grievances, legitimate grievances, and that would certainly give rise to suspicions, especially when you've got things that are government mandated, or you've got certain projects that to which the government is trying to make people adhere. So you can't blame certain people, certain groups of people for being suspicious. However, I think there's at some point you have to trust somebody. It's again, I didn't get the COVID vaccine for me. I got it to really protect my patients. If there's a chance that this can keep me from getting it and from spreading it to my very sick patients. I've got patients who are elderly, who've got metastatic cancer with almost no immune system, other people with AIDS, respiratory failure. I mean, they're hooked up to mechanical ventilation. I mean, I'm the one here taking care of the patients, not some anonymous troll person. you know. So I feel responsible and accountable to try to protect them. I think that if I got COVID, if I haven't had it already, I've gotten tested for COVID multiple times. I've always been negative, thank God. Hopefully they're not false negatives. There's always a slight chance of that happening. But you know, if there's a chance for me not to get the virus and then give it to them, and then give it to my very sick patients, I'm willing to take that chance with my own health. And I think that's my right. It's the right of others not to get the vaccine if they so desire. You know, nobody likes being told what to do, but then nobody also likes to take accountability for their actions or inactions. You know, and as a healthcare provider, especially one that's what one would consider a mid-level or advanced level practitioner, I've got a lot of accountability when it comes to taking care of people. Think of your loved one. Think if I were to be taking care of your loved one, and then me with my relatively healthy self, me who may come to the hospital low symptomatic or even asymptomatic, and give the virus to your loved one. They came here without COVID, and now they have COVID because of me, you know, and then they die or even come close to death. You know, how angry would you feel at me? Pretty angry, I would imagine. You know, I personally think if I got COVID-19, I think I'd shake it off. I've had various flus, and not that I'm saying that COVID is the flu, but I've had flus and pneumonia before, and you know, I shook it off, thank God, alhamdulillah. So I don't know that it would affect me that bad, but it would certainly be devastating to some of my patients. Okay, guys, so again, leave your comments in the comments section, even your negative comments. For those of you guys that want to come up with conspiracies of where the COVID-19 came from and what the vaccine is doing to people, and even attack me, I welcome it. I've had fun reading your comments. They're pretty creative. In fact, I think I'll have a competition. I want to see who can come up with the most creative conspiracy of where the COVID virus came from and the you know, what the COVID vaccine is. I just want to see what people can come up with, and include the events of all last year. You could include BLM. What else happened last year? Mass shootings. What else did we have? We had all sorts of stuff happen. Now you got the protest here, or the takeover of the Capitol building. I got to get home. I live on the other side of D.C., so everything's blocked off by police and soldiers. So it's going to take me a long time to get home, probably like an hour and a half, because so many streets are blocked off. So include that also. Yeah, this is all linked together. You know, it's about control, man. So I want to see what you guys can come up with. And give me a thumbs down while you're at it. I'm not even going to ask for a thumbs up. Even if you like this video, give me a thumbs down. I want to see how many thumbs down I can get. For those of you guys that are applying to PA school for this cycle, you can ask for advice in the comments section also. I've been a physician assistant for 20 years. I've really enjoyed it. I did infectious disease for 15 years in outpatient treatments, and I've been a hospitalist for the past 5 years. So, yeah, give me your questions, and I'll try to answer them to the best of my ability. So I wish you guys the best of success in your positive endeavors. I'm tired, not because of the vaccine, but because I've had a very long shift today. Taking care of sick people is it ain't easy. You know, it requires a lot of mental, spiritual, and physical endurance. Okay, guys, take care. Peace.